Thank you, Deputy Speaker, and I rise today to grieve for the risks to Victorians' health system from the Liberal Party annihilation from the Kennett, Baillieu and Napthine policies and the risks they face from the Liberal National Party. And it's 1 year out from an election, and recently it's been suggested that Victorians have a choice. Well, Deputy Speaker, I think that is exactly what an election is, of course, all about. Firstly, I'd like to acknowledge the great contributions by the member for Wendouree. I thought it was fantastic, but also the contribution by the member for Morwell, and it was a great contribution, and I thank him for it. Deputy Speaker, Victorians do have a choice. They have a choice to return to cuts to infrastructure, schools and health services delivered by the Liberal National Parties, or by the record investment promised and delivered by the Andrews Labor government. In a train wreck interview, we've seen that the Leader of the Opposition has Kennett government coasters on his desk and Kennett government policies and cuts in his back pocket. Their track record shows it's every time they occupy the Treasury benches. The cuts on our services get rolled out every time like a badly curated compilation album. Victorians deserve better than those opposite. Thankfully, they do have a choice, and Victorians are already appalled that a former Liberal Health Minister of all people, Mr Davis and Mr Finn in the other place, and of course the member for South West Coast, a registered nurse, would even consider giving a minute of their time to radical anti-vaxxers peddling COVID infections and conspiracy theories on the front steps of this parliament. Victorians do have a choice, like the 93.3% of Victorians who have rolled up their sleeves to keep Victoria safe, or the minority of Victorians who spread pandemic health misinformation, like Mr Finn in the other place. Or, of course, the opposition shadow health minister spreading scare campaigns that put women in danger by missing breast screening. Dangerous political games and cuts is what they can promise to deliver. I guess we can't be too surprised, because we know that the former Liberal Health Minister's #1 priority when he was in Cabinet was attacks on healthcare workers. He attacked and undermined nurses, those same nurses that have worked their guts out for Victoria these last 20 months. We had a former Liberal Premier flipping nurses the bird.
Coast and the Minister for Family Violence, Prevention of Family Violence, I ask you to stop. Order. I ask you, order. The member for Melton without assistance from those at the table. Member for Melton.
Thank you, Deputy Speaker. They flipped the bird to nurses, doctors, health workers, mental health workers and, of course, my members, paramedics. When they were last in office, the former Health Minister started a war on paramedics, and I remember that war all too well as the Secretary of the Ambulance Union, where we had to put out messages on every ambulance to let Victorians know that a Liberal National Government was no friend of health workers in Victoria. And of course, one day they will realise that's why they're sitting over there in those opposite benches. Leadership is supporting your frontline workers, not undermining them during the pandemic by pandering to conspiracy theorists. Leadership is supporting the health system in investing in your healthcare workers and not cutting their wages and conditions, and certainly not cutting their jobs. So 1 year out, Victorians do have a choice. They have a choice for the investments like the $1.3 billion investment to boost our health system capacity during the pandemic. In response to the pandemic, we have made significant investments to boost hospital capacity in preparation for increased hospitalisations, including the $1.3 billion to deliver more beds and PPE. We have invested in more than 30 small capital projects to expand critical care capacity in hospitals. We delivered new beds at Baxter House at Barwon Health, the former Peter MacCallum Cancer Centre, and provided more beds at Bendigo Hospital. We've built a strong clinical surge workforce pool, which since July 2020 has completed more than 120,000 shifts across various healthcare settings, helping our health system flex through peak demand periods. And of course, we've launched training packages which provided over 23,700 places for the ICU, general nursing and aged care workforce on the clinical skills and infection control required to support COVID-19 patients to keep them all safe. This has resulted in over 12,350 nurses upskilled in critical care training in the past 18 months. We've also supported our hospitals and health services to recruit up to 1,000 healthcare workers from overseas, and in addition to the hundreds of healthcare workers who have already arrived under the dedicated healthcare workforce pathways. Of course, these workers, who are mainly returning residents from the UK and Ireland, will relieve the pressure on our existing healthcare workers that they're under and provide them a timely boost as we look to increase the number of elective surgeries. And let me talk about elective surgeries. Despite the heavy impact COVID has on our health system, over the 2020-2021 year, our doctors and nurses were still able to admit 163,628 patients from the elective surgery waiting list. The Andrews Labor government is proud to have been able to support the efforts of hospitals and their staff to deliver these surgeries, whilst also coming to grips with COVID. And while COVID has caused delays to non-urgent patient surgeries, we may need the necessary investments so that as hospitals become ready, they can provide the treatments, procedures and care patients require. We have funded a $300 million elective surgery blitz and an additional $136 million to complete even more elective surgeries. And thanks to the work of Victorians to get vaccinated in record numbers, we were able to announce that even more non-elective surgery will be switched back on this week as healthcare staff and hospital wards become available again. Ballarat, Bendigo, Shepparton and Latrobe Valley public hospitals are now able to resume up to 50% of normal elective surgery, and private hospitals that were focused on COVID patients can increase elective surgery up to 75%, so long as they continue to first assist with the COVID-19 response. This is in addition to the many public hospitals that are already delivering non-urgent elective surgery as and when they have capacity, and every hospital that's continuing to provide urgent surgery. And for the hospitals, the Andrews Labor government's record funding for Victoria's hospitals is saving lives and giving more Victorians the world-class treatment and care that they deserve faster wherever they live. More than $8 billion of health, hospital and ambulance projects are currently underway. Whether these investments are the $1.5 billion investment to deliver the new Footscray Hospital or one of the many ambulance stations getting built near you, we will all benefit from these investments. In the last term of government alone, in 2015-16 to 2018-19, we funded $3.2 billion in hospital upgrades, including the Victorian Heart Hospital, the new Joan Kerner Women's and Children's Hospital. Yeah. Sadly, the Liberals and Nationals only spent $1.6 billion on hospital infrastructure in their last term between the years of 2010 and 2014. But we will not rest on our achievements. We are already planning new projects, whether that be new emergency department expansions, community hospitals or early parenting centres. We know there is more work to be done to improve our health system. So since coming to office, this government, the Andrews Labor government's investments in our healthcare system and the workers that look after us total more than $133 billion. And these investments, while delivering new hospitals, still keep the focus on the most critical element of our health system, and that's the healthcare workers that care for us and keep us safe. And the recent budget, Victorian budget, is delivering $3.7 billion over the next 4 years to support our health workforce to meet increased demand and continue providing Victorians with the care they require. This is in stark contrast to the Coalition, who cut $1 billion from health during their 4 years in office. The Liberals promised to open 800 new hospital beds, but only opened half of that. So let's talk about ambulances, which is where I come from. The Andrews Labor government ended the Liberals and Nationals' war on paramedics. That's a pretty good new name for the government, isn't it? The Ambulance Labor government. Yeah. Maybe I'll work on that one. So, to make sure that our paramedics and non-emergency patient transport workers have the support they need to meet this demand, this government has delivered record investment in our ambulance services. This includes the recently announced $40 million in targeted funding to support ambulance to boost their capacity to manage increased COVID caseload and provide surge capacity for patients with less serious conditions that still require transport and hospitalisation. The funding will provide 58 non-emergency patient transport vehicles Up until the Kennett government privatising this service, Ambulance Victoria did all of this work. The funding also delivers more than 200 student paramedics and 13 additional peak period units. And of course, additional paramedics to provide care and handover and assist with the flow at emergency departments, and that's where paramedics are in assistance at emergency departments to assist with getting patients off the ambulance trolleys as they arrive. That's on top of the $759 million the Victorian budget, 21-22 budget, is delivering to boost capacity across our ambulance services, emergency departments, and of course our hospitals. And this investment provides $470.5 million for Ambulance Victoria for additional paramedics, adding to the hundreds that have already been recruited since November 2020, an expansion to Ambulance Victoria's secondary triage services, including additional clinicians to support non-urgent calls, targeted initiatives to drive performance improvement at the ambulance hospital interface, which is what I just spoke about, where they have additional staff there, an expansion to the statewide 24-hour mental health service that connects paramedics with mental health clinicians via telehealth, which enables them to better care for a patient that's having a mental health incident. We've also launched a new medium acuity internal patient transport resource supported by 22 new vehicles and 165 staff to provide timely care for less urgent cases across metropolitan and regional Victoria. And of course, it's pleasing to report that this important initiative has now hit the road in key regional growth areas, including Geelong, Belmont, Traralgon, Wonthaggi, Wendouree, Shepparton, Bendigo and Eagle Hawk. And I'm sure all of those areas will notice a difference in the ambulance responses. Deputy Speaker, the choice for Victorians 1 year from now will be to choose a government like ours that delivers a health system for all Victorians, or to choose the opposition that creates a healthcare workers crisis with a war on paramedics and nurses. We see what the Liberal Party prioritises. The Federal Health Minister, a Victorian on paper, Greg Hunt, rolled out vaccines for Sydney, whilst his Liberal mates in New South Wales let Delta spread into Victoria. Liberals don't have time for getting vaccines into Victorians' arms as a priority. They were very happy for their constituents to be in lockdown while sinking beers in Sydney. Hopefully Greg can retire peacefully and spend time in New South Wales where he clearly wants to be. The choice Victorians have is a government that delivers on what it promises, or the opposition that puts Victorians last. And I have a feeling that Victorians will put them where they put Victorians, and that's last. Deputy Speaker, I grieve because I know that those opposite have a clear track record on not delivering infrastructure, jobs or quality healthcare, especially in the West. And it's this government that has committed to building the Melton Hospital. The Liberals haven't committed to supporting this massive piece of infrastructure or the thousands of jobs that it will create. In July this year, the Minister for Health, Martin Foley, announced that the land at 245 to 267 Ferris Road, Cobblebank, has been selected as the site for the new 24-hour hospital, following extensive planning with the Melton City Council and the Victorian Planning Authority. This is an important step and part of the Labor government's $77.4 million investment to deliver a business case, purchase the land and progress detailed planning for the new Melton Hospital. I should also say that it's only a Labor member that will deliver these vital projects, just like we're delivering new ambulance stations for Melton West and Melton South, or construction that's about to begin in Taylors Lakes. The new Bacchus Marsh ambulance station that was opened, or the upgraded unit in Baillieu that I opened with the hard-working member for Bunningham. And also the new hospital investments in the West, such as the Joan Kerner Women's Hospital and Children's Hospital. The new Footscray Hospital, as I previously referred to, the $1.5 billion, and it's fantastic to drive along Ballarat Road and see the side of all the cranes and all the work that's being done. It is amazing, and it will be a fantastic facility. I also refer to the Werribee Mercy Hospital critical care expansion. $87 million for the Werribee Mercy critical care expansion was completed in August 2018. This government is also investing $675 million to build community hospitals in major growth areas, including Point Cook and in the West. So I've been through a whole range of items here, and there's many more to come in regard to what we're doing for health in the state of Victoria. And I know the Victorians will have a clear choice in 12 months' time of who their preference will be. And I'm sure it's on this side of the House and our side of politics.
Member for Narrowcan.